Your organization was instrumental in getting Obamacare passed. So now in 2014, what is next on your communist agenda?
As a campaign, we've actually been winding down. And so we've been doing something that most campaigns don't ever do, which is we decided not to exist forever. So we're winding down as an organization. So our next job is to help our organizations that have been working with us continue to do the work that they do. We set out to win healthcare reform. We did. We went about the business to implement and move it forward, and we did. And it would be ridiculous to say mission accomplished. But for us as a big coalition, we did what we were supposed to do.
Yes. And your communist agenda, what's next?
Well, that's a very good question. And I just have to say, it's not a communist agenda. I don't know if you've been paying attention to the news. It's a Kenyan socialist agenda. Keep up, for God's sakes.
The focus of your work is on private markets and consumer protections. Can you tell us about some of the consumer protections in the Affordable Care Act?
Sure, yeah. Well, gratefully, I think more and more Americans are starting to realize this. But all of the new plans in the marketplace have a load of more new consumer protections that just did not exist prior to the Affordable Care Act. People can't be denied coverage based on a pre-existing condition anymore. Women can't be charged more than men anymore. And once you get the coverage, it's actual real insurance that provides real security and peace of mind to consumers. They can't take away your coverage if you get sick, and there has to be a core set of benefits that all of those plans cover. So they cover things like maternity coverage and drug coverage and mental health and substance abuse services, which people might not be aware of, but it wasn't always a guarantee that that was in your benefits package prior to the Affordable Care Act.
Working in government relations, are you also working on the Medicaid expansion in states that haven't accepted it?
We have, yes. We worked in states like Virginia and elsewhere where it hasn't happened yet. It's important for the program, and it's important for the Medicare program because, both the Medicaid expansion and also the availability of health insurance to the exchanges through the Affordable Care Act to so-called younger seniors who are between the ages of 50 and 64. If they receive health care during that period of time, that means that they're going to go to the doctor on a more regular basis rather than being treated acutely and more expensively through an emergency room, so that by the time they reach age 65 and they are Medicare eligible, it means that they're going to be healthy. And if they're going to be healthier, obviously that's better for them, but it's also better for the Medicare program because they're going to be less costly to the Medicare program while they get there.
What's your strategy in the coming year to pressure the governor to expand Medicaid in the state?
Really just making sure that the citizens know what that means. They know that $6.6 billion of their federal tax revenue is going to be going to other states, and they know that when hospitals start closing, and they're oftentimes the biggest employer in rural communities, that's because our governor said no thank you to the federal funds. Our governor has tried to blame his failure to expand Medicaid on the Obama administration, and that's really smoke and mirrors. He hasn't asked the Obama administration for a plan, and so basically we're hoping to educate the public because about 63% of Tennesseans already want a Medicaid expansion, and we really think if people understood the facts it would be overwhelming.
So you don't see this being really good cannon fodder for Republicans in the 2014 elections?
Well, I think that they're going to get some mileage out of it, but that's just because they're going to spend so much money on it. I don't think that has much to do with this issue intrinsically. I think it's just about the number of TV ads that they're running. Again, if you look at North Carolina, they've already spent $10 million starting in 2013, and opponents, super PACs, will run ads largely focused on Obamacare for more than a year before the 2014 election. I don't expect that opponents will have anywhere near supporters will have anywhere near the same throw weight in terms of how much they run in support of Obamacare. But again, I think that in the context of other issues and in the context more broadly of what's going on with people economically in this country, Obamacare is going to fit into that story in a way that helps Democrats.
Tell us about your efforts to advance the implementation of Obamacare in Wisconsin.
Well, we're in a difficult situation, as a lot of your viewers know. Our governor is Scott Walker, and so he has made it his mission to be as against health care reform as possible and do everything he can to sabotage and undermine the program, including turning down the Medicaid money and in fact spending more money to cover fewer people with this bizarre alternative plan he had, because primarily he sees this as setting up for his run for president in 2016, and it's thinking about Republican primary states in 16, not the state of Wisconsin. And so every step of the way we've been fighting him. We have grassroots activists around the state challenging every time they undermine the program in various ways, the way they try to lie about the program, the rates, every other element of it, and mostly really to call attention to just how destructive, self-destructive it is to turn down money to cover people.
Sometimes us progressives, we spend too much energy on lamenting the not perfect. And the Affordable Care Act is such a huge step forward that we need to rejoice and celebrate it. I've got a pope right now, which is really nice, that's saying we've got to have joy. And joy in celebrating the step forward that the Affordable Care Act is important. We also have to say it's not the end of the story. We've got more work to do.
So do you think the Pope would support single payer?
I have no idea. It's a complex thing. What he'd say is everybody has a right to health care.
Undercurrent under the surface makes the mainstream get so nervous. It's time for purpose, for news to serve us, not with propaganda they use to hurt us. Time to get right, time to shed light, ride the riptide and please.